I came to this course because I felt I needed to learn more about Modi and various things. And I'm so happy I made that decision because I learned so much in the last 2 days. The program is very cleverly organized with a very interactive approach, giving enough time for people to ask questions. There is enough time in order to, relax after the session so that people are not, within inverted commas, crammed with knowledge so that nothing actually goes after that one.
The reason I decided to come on the course is that it's just such a fantastic lineup and an opportunity to get this information all in, bite-sized pieces in a couple of days. It's really hard actually to get this sort of information online in a usable, readable format. So being able to have expert speakers and have the ability to discuss with colleagues individual cases you may have come across is just a fantastic thing.
I came here on this course because of some of the work I do with diagnosis of diabetes in my emergency clinic, some of the work I do with GPs about how to diagnose and manage diabetes in the community, and some of the complex diabetes work. I've really been thinking about how and what am I treating. This course, I think, has added some really phenomenal new concepts for me about how to diagnose, investigate and manage my patients with diabetes, as well as look for all those missing Modi patients that I feel I've got more and more as I've done more of the course.
I think it's a very wonderful opportunity to all clinicians, pharmacists, nurses that really are very interested in monogenic diabetes. And I think this is a unique opportunity because you have this great presentations with people with a lot of knowledge, very experienced in the field. And so you have also the opportunity to talk to these people afterwards. And then there's this small group talking that you discuss real cases. And you really can go deep if you want to.
During these 2 days, you get a fantastic overview over all forms of Modi and neonatal diabetes cases. And what is make this course very interesting, even for experienced consultant, that you get good clinical tips and information where you not get in papers or any other settings.
So the course is delivered in such a way that it allows whatever background you're from, whether you're from a dietetic, a nursing, a pharmacist or a clinician background, enables you to kind of think from your perspective where you're going to come across these patients. And it's really useful information that you can all digest and be able to take home to be able to actually implement in practice in your current role.
This course has just been terrific. It has given me the foundation as well as a review course.
I consider myself a bit more experienced in the field. I still think it's very, very important to come because you can actually, all that, things that you don't read in papers, in journals, and you can discuss with the most knowledgeable people in the planet. I think Exeter is a real reference place in the world, in Europe, in the world of monogenic diabetes research. So I'm really glad that I came. And the one thing that I also think it's very important, it's networking. And then you manage to know people that are doing the same thing that you do, same doubts, same problems, and maybe great solutions.
I think essential for anyone that works with patients in diabetes, you will be coming across these people. And I think it's really important that at least someone in every centre is trained up to be able to be that link person and knows the principles to be able to educate the rest of their teams, but also to do the right thing for those patients who are currently misdiagnosed.
I can tell from the bottom of my heart, any person who has a workload of diabetes, irrespective of whether they are a pediatrician or an adult diabetes professional, if they haven't gone on this course, they haven't done their training.